Welcome, everybody. I'm Steve Chuck, and I'm the coordinator for Honoring Choices North Central, Indiana North Central here. And we operate in our region here in Northern Indiana, and we are part of the Center for Hospice in Mishawaka. So today we are actually at the Center for Hospice Care, and I am with Barb here. We're going to have a discussion about advanced care planning. Center for Hospice and Honoring Choices is promoting advanced care planning, which helps us answer the question, who would speak for you if you could not speak for yourself in a healthcare crisis? And so we help people have the conversation, make decisions, and then document those decisions so that they are honored by their physician. So Barb is a liaison here at Center for Hospice Care.
Yes.
And Barb, what brings you here today?
Well, I actually have some questions regarding my advanced directives. Me being a mother and a wife and a caregiver, how important is it for me to already have my advanced care directives?
That's a great question, and especially if you're a younger, healthy person, you think, well, this isn't so a big deal for me. But actually it is, because especially like with COVID anymore, we see that people end up in the hospital at any age, unable to speak for themselves. And so we believe that everybody over the age of 18 should have their healthcare directives completed and have the conversation with their family so their family understands the choices that they would like to have honored by their physician.
So, so then me having a conversation with my children or with my husband or with my loved ones, is that not enough?
That's a great question, and actually the conversation is huge. Because it's not enough to simply complete documents. Some people do that and they complete the document, but nobody knows what their wishes really are or what the documents even say. So the conversation is extremely important. That way everybody knows what your wishes are and why those things are important to you. But then you can document those so that your physician actually sees those, place those in your healthcare system so that they can honor those if you're ever in a crisis like that.
So then who ultimately should all have copies of my advanced care directives then?
We recommend, a lot of people, they'll fill out their documents, they'll leave them with a lawyer, which is fine, or they'll put them in a safe place at home. But what we really want people to do is complete those and put them out in every place they can. For example, one of the decisions that you're going to be making is who should speak for me. That's called a healthcare representative document. And so you want to appoint somebody who can speak for you and knows your wishes, and then you complete that form. Then they have that form, your family has that form, your medical provider has that form. We even encourage people to put them in their cars and take them with them when they travel. These are documents that really need to be disseminated wherever anybody is going to need it.
Okay. And so then what if, let's say 10 years down the line, something happens? What if I want to make changes? Then how would I go about doing that?
These documents are state specific and they're fluid. In other words, if you ever say, you know what, my healthcare representative moved to Botswana and not available anymore, what you could do is tear up the original one, write up a new one, start over again, and they actually should be reviewed every 5 to 10 years. There could be a death of a family member, or there could be a change in your financial situation, or your situation, your marital situation, things like that. And so those are important times to review those documents and say, do these really still say what I want? And then what you need to do, of course, is place those with your medical providers as well and let them know this supersedes the old.
Okay.
Yeah.
Wonderful. Steve, that's all the questions that I have.
Well, very good. Well, Barb, thank you for meeting with us today. And we encourage everybody 18 years of age and older to get these documents completed. We also want to let people know that we will go to your organization or your business and we can discuss with you advanced care planning. We can talk about what that involves and educate your group. And then we can also sign people up. These conversations and completing the documents, we do this free of charge. And then we also invite community members to contact us at the information below. And you can get information on how we could have someone meet with you either virtually or in person as appropriate and have the conversation and complete your documents. So thank you all for joining us today.